So a couple of big changes have happened. One is, of course, the newer types of technologies coming along that are targeted genetic technologies that can sort of get at the root cause of rare disease, which most of them are genetic diseases. The second change I see, which is actually really has huge implications, I think, for child neurology as well, is the increase in genetic testing. It's really completely snowballed in the last 5 years, and to the point now where child neurologists and even in some cases pediatricians will go right to genetic testing when they think that a child has a genetic disorder, rare disorder. And I think that's going to continue to cause changes within the field and really accelerate the development of drugs for rare disease. And then the third thing I've seen is really the increasing role of advocacy groups and the importance that advocacy groups play in the rare disease drug development process, which is great. So I think one thing is increased genetic testing definitely offers hope for patients and caregivers. A lot of times in the past, they were kind of lost trying to get a diagnosis for a very long time and very frustrated going from provider to provider. So just the increased availability and use of genetic testing really shortens that. But then I think the implication that falls on is that they require counseling or getting to the right type of child neurologist once they get that genetic diagnosis. And I think that's sort of the critical area now for child neurology. Making sure that there's enough child neurologists familiar with some of these rare diseases. Some of them are very rare, so they may not have heard of them or heard of one patient back when they were in training. And that's a role that the advocacy groups can play, is really help increase awareness of some of these diseases. And that applies, I think, broadly to child neurology as well as Rett syndrome.